my name is Veronica Praise, and I am an adult gerontology student in William Patterson. Today we'll be performing a HEENT respiratory and cardiac assessment on my patient Ala. Do you consent to this video?
Yes.
Okay, we're going to get started. I'm going to be speaking to her directly as well as to the camera. First, I'm going to be assessing her overall appearance. Her head looks symmetrical, face looks symmetrical. I do not see any facial drooping, no asymmetry in her eyebrows or eye droopings are present. And I'm going to begin by palpating her scalp, in which I do not feel any lesions, no masses, no depressions in her scalp. Have you had any recent trauma?
No.
Okay. Next, I'm going to be palpating her TMJ. I'm going to be feeling for any dislocation or hearing any clicks or crepitus. May you please open and close. I do not feel any dislocation. I do not hear or see any clicking or crepitus. Next, I'm going to be assessing her sinuses. So when I palpate, I'm going to palpate for any tenderness or any pressure or pain. Do you feel any of these things?
No.
Okay. And I will be palpating her sinuses up here. Do you feel any pressure, tenderness, or pain?
No.
Okay. Next, I'm going to be assessing her sclera and conjunctiva of the eye, just the external appearance, in which I do not see any tearing, jaundice, or any drainage coming from the eyes. They look white and clear. Her conjunctiva is pink. No drainage of any kind, no fluids of any kind besides the norm. Next, I'm going to be assessing her pupil reactions. I'm going to get my light. Okay, turn this on. This is the ophthalmoscope, and I will be checking her red reflex, the retina, the vessels, the optic disc, and the macula, as well as the pupil constriction, making sure that they consensually and directly react to light. Okay. So they directly both react to light, as well as both consensually, which means both pupils are constricting at the same time, even though the other is not having light shined. Then I'm going to be looking at the red reflex to make sure that it is present and equal bilaterally. Both eyes have red reflex, are present, symmetrical bilaterally. And now I'm going to be looking at the retina, the vessels, and the optic disc to make sure that they are all normal. Okay, the optic disc is nice and sharp, edges are not blurred, vessels are noted, and there are no vessels around the macula either. Next, I'm going to be moving on to the ears. Okay, I'm going to pull your hair back. Upon the ear assessment, I'm going to be looking at the ears bilaterally. I do not see any deformation, trauma, lesions, or foreign bodies present. Now, with the adult, you're going to pull the ear up and back, and with the pediatrics, you're going to be pulling down. In our case, this is an adult patient, so we'll be pulling up and back to check the tympanic membrane. It does not appear to have any fluid, and the tympanic membrane is nice and pearly gray. Okay, I'm going to be checking the other side as well. Do you have any tenderness or pain?
No.
No. I'm going to turn her so you can see that I'm assessing her the same here. Okay, this all looks pearly gay. There's no fluid or any foreign bodies of any kind. Okay, there's no tenderness on the left ear as well. Next, I'm going to be assessing her hearing. So there's going to be a series of tests, a whisper test first. With the whisper test, I'm going to stand behind my patient and I'm going to ask her to repeat the letters and numbers that I will be saying and cover one ear, and we're going to do the same with the other side. Okay, can you please cover your left ear for me, please? I'm going to be whispering letters and numbers, and I would like for you to repeat it, okay? 1-8-T.
1-8-T.
That was correct. And now we're going to do the other ear, the right ear. Please cover your right ear. 2-3-T.
2-3-T.
Perfect. So the whisper test was successful. No present hearing loss. Next, we're going to be doing the Riney exam, which checks the bone and the air conduction in hearing. So I will be starting on her right ear and then move on to the left ear. Tell me when you stop hearing.
Stop.
Okay. Now, which is greater, the air conduction or the bone conduction?
The air.
Okay. And I will be doing the same on this ear. Tell me when you stop hearing.
Stop. Okay, now it's stop.
Okay. Which one was greater, the air or the ear conduction?
The air.
Or the bone conduction?
The air.
The air. Okay. So she does not appear to have any kind of hearing loss, and there is no air conductive deficiency or hearing loss. Now we will be doing the Weber test. So I will also be striking and placing it on her forehead, in which she should hear it on both of her ears. And if she hears it in one and not the other, we will have a positive hearing loss. Do you hear it in both ears or in one or greater than the other?
In both. In both equally.
Okay, so we do not have any issues present with her hearing at this time. Now I will be assessing her nose. Externally, in appearance, it looks symmetric. I do not see any deformations or any asymmetry at all. I do not see any drainage of any kind. Now I will be checking internally. May you please lift your head up. Okay, light is on. Okay, in this it looks nice and pink, does not look any irritated. No deviation is present, as well as the left and the right nostril does not indicate any abnormal findings. No drainage is present, no irritation or redness is present. Next, I'm going to be assessing her mouth. First, I'm going to visually assess. There are no lesions present on her lips. Please smile for me. The gums look nice and healthy and pink. I do not see any plaque of any kind. May you please open your mouth for me? Say ah. I'm going to be checking her tongue. It's pink. No signs of issues here. Okay, please stick your tongue out. Say ah. Here. Everything looks normal. Gums look good, nice and pink. Soft and hard palate look good. Hard tonsils are grade 1, which no irritation is present. No swelling is present. And do you have any pain?
No.
No pain is present. Okay, no abnormal findings. Next, we will be moving on to her trachea. Can you please lift your head up for me? Her trachea looks nice in midline. No issues there. Are you experiencing any breathing problems, any shortness of breath? No. Okay, good. So now I'm going to be palpating her carotid arteries. So now I'm going to be checking one each side because then it can possibly cause fainting, and we do not want to do that. That is nice and strong. On the right as well, it's nice and strong. I'm going to auscultate to make sure there are no bruits. Okay, no bruit present, and I did not feel or hear any thrills at all. I'm going to now check for any jugular vein distension. Please tilt your head back a little bit. Okay, upon inspection, no presence of any distension at all. Bilaterally, okay, that looks good. Now I'm going to be palpating her thyroid, in which I will be going behind her. Okay, it may look like I'm strangling her, but I am not. We just want to make sure that we have an adequate test. So with your index finger, you're just going to move the thyroid around so there are no any swellings, growth, and that it's moving normally. You do not feel it too enlarge, in which it does not feel large. May you please swallow? Everything feels normal. There are no abnormalities present. Okay, you may lay back down. Next, I will be assessing her posterior thorax. I'm going to ask her to turn around this way so you can see the full assessment here. Sorry. First, we're going to be assessing the symmetry of the thorax. Does not look like there is any asymmetry, no injuries present. Sorry.
It's okay.
No side is higher than the other. She is breathing bilaterally and equal on both sides. Does not look like she has any respiratory distress. Do you have any difficulty breathing, Ala?
No.
Okay. We're gonna palpate her tactile fremitus. It's going to check the vibrations for equal and if there's any dullness. If stillness is present, it means that there may be liquid present. Every time I place my hands on your back, I'm going to say 90. You're going to say 99.
99, 99, 99, 99.
Okay. So the vibrations felt normal and equal on both sides. No dullness indicated. Next, I'm going to be percussing for both fields. This is going to check for tympany and for dullness as well. Okay. That also felt normal. The tympany was there, no dullness was present. Next, I'm going to be listening to the bronchophony, in which my patient will be saying 99 as well, and I'll be listening and auscultating as well. Every time I place my stethoscope on you, you can say the words 99.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. They all sound normal, and I'm going to listen to her lung fields. Every time I place my stethoscope, you're going to take a deep breath. Okay? So no abnormal findings were present. And now we're going to be assessing her anterior thorax. We're going to have Ala turn around for me. So looking at her chest, where it's also symmetric from the front, I see symmetric breathing. Her chest expands normally and exhales normally. Do you feel any difficulty expanding your lungs?
No.
So first I'm going to palpate her tactile fremitus, but only the regions that I'm able to. Just like posteriorly, we're going to do the same thing. I'm going to have you say 99 when I'm going to have my hands on your chest.
99, 99, 99, 99.
Okay. That is, I felt normal vibrations with the tactile fremitus. Next, I'm going to be auscultating her lung sounds from the anterior thorax. Every time I place my bell on your chest, you're going to take a deep breath from me. Okay. Her lungs sound clear, no diminished lung sounds, and I do not hear any adventitious breath sounds as well. Now I'm going to be listening to your heart while you're sitting, and then we're going to have Ala lay down as well. With this, I'm going to be listening to the 5 areas and all of her valves, and I will be saying them out loud. First, I'm going to be using the diaphragm. Okay. You can breathe normally. This is the aortic valve. This is the pulmonic valve. This is Erb's point. This is the tricuspid valve. And this is the mitral valve. Okay, and I will be doing the same assessment, but with the bell. Aortic, pulmonic, Erb's, tricuspid, and mitral. Okay, I hear S1 and S2 heart sounds, no extra heart sounds present, no S3 or S4, no murmurs present or heard. Next, I'm going to have you lie down for this assessment. Now I'm going to be assessing Ala's heart sounds while she's laying down. Okay. First, I'm going to be listening with the diaphragm and then with the bell. And purposes for the video, I'm going to be listening over her clothing for privacy purposes. Okay, you may breathe normally. Aortic valve. Pulmonic valve. Erb's point is in the center. Tricuspid valve is closer to the left. Midclavicular line and the mitral valve is the 5th intercostal space, midclavicular line. Okay. Okay, and with the bell we're going to be doing the same. Aortic, the pulmonic valve, Erb's point, closer to the center, pulmonic, tricuspid, and left lower, 5th intercostal, midclavicular is the mitral. Now for the maximal impulse is the midclavicular intercostal space near the mitral valve. Please sit up while I test cranial nerve 5 for your sensations. I will touch your face while your eyes are closed. Please tell me where I am touching you.
My forehead, my cheek, and my jaw.
Cranial nerve is intact. My patient was able to identify ophthalmic, maxillary, and mandibular. I'm going to palpate the lymph nodes with both hands in a circular motion to feel any enlarged nodes. Occipital, postclavicular, preauricular, submantle, anterior cervical. I will do this twice, superficial and deep. Posterior cervical. Can you shrug your shoulders? And now I am palpating in your supraclavicle region. I did not find any evidence of enlarged nodes. And now I'm looking, I'm going to be doing a visual acuity test. Okay. We have a Snellen chart here. Okay, please read line number 8.
DEFPOTEC.
Okay, the test concludes that our patient has 20/20 vision. Okay, and Ishihara test is going to test for color blindness. May you please read the number here?
56.
Correct. We have normal findings and no color blindness is present. And this concludes our assessment here today. Thank you, Alla, for being our patient. And have a great day, everyone.